Hi, I'm Dr. Tiffany Powell-Wiley. I'm a Statman investigator at the National Heart, Lung, and Blood Institute, and I'm also an adjunct investigator at the National Institute on Minority Health and Health Disparities. I've been a proud AHA volunteer for much of my career. I started as a medical student coming here to present at AHA, and now I'm happy to be a investigator bringing the research fellows who work with me to present their work, and it's really exciting to be a part of AHA. So I was fortunate to become involved with the Health Innovation Group about a year ago. Really, it was based on the work that we're doing in my lab, focused on using digital health technology to promote improve cardiovascular health, particularly among those who are resource limited and live in communities where there's limited access to health care. So there's certainly a great deal of promise and possibilities with the technology that we have available, whether it be mobile apps or wearable technology or even many of the sensors that are being developed. And really, a lot of that promise has to do with providing access to monitoring and to better understanding a patient's health, even if they don't have access to the healthcare system. But what we need to really think about is how do we make those types of solutions, those technology solutions, affordable, available, and accessible for those who may have limited digital literacy or health literacy. So I think my biggest thing that I push right now as far as advice for innovators is really thinking about the end user from the beginning of their design and thinking broadly and thinking about diverse populations when you're thinking about that end user. Trying to use and incorporate user-centered design approaches in the work that they do and really get input from diverse communities, from low-resource communities, from women, from people of color, those who are traditionally underrepresented in research. Make sure that they have input on the design of the technology that they're building. So over the next 30 years, I envision a world where we're using quite a bit of technology to monitor our health, but that we are at a point where we know that information that we're getting is safe, that we are maintaining privacy, and that we're creating algorithms with that data that are equitable and treat people in a way that treats them with dignity and respect. But also, I think, as you mentioned, in terms of primordial prevention, we want to really get to a point where we're using technology to identify those who are at highest risk and really targeting interventions to those before they have their first heart attack or we're seeing in the hospital for risk factors.